Hello, hello, hello. Good afternoon. Happy Wednesday. Today is Wednesday, right? It's hump day. We're in the middle of the week. Thank you so much for joining us. And we're starting right on time at 3 o'clock. Good afternoon once again. My name is Shay Parker, and I'm a media personality at 93.9 WKYS. You might hear me on the radio sometimes every weekday, Monday through Friday, from 10 a.m. until 3 p.m. And I am so excited to be here. This is going to be a really important discussion. 2023 is right around the corner, and we're all talking about what we're going to do, what our plan is for 2023. And we want to make sure that health insurance and health coverage is in your plan. Now, today we've partnered with Maryland Health Connection along with Maryland Health Benefit Exchange to talk about not only low cost health insurance, but free health insurance. And that's something that you may be eligible for, especially if you live in the state of Maryland. Now, today I have a really special guest with me. Her name is Kayla, and she is actually a navigator from Prince George's County. She's going to be talking to us all about what is available in the Maryland health coverage marketplace. Hi, Kayla. How are you?
Hi, I'm good. Thanks for having me.
Of course. Thank you for joining us today and taking the time out to talk with us in the DMV about what is available to them if you live in the state of Maryland. Now, first things first, Kayla, let's talk a little bit about what you do at Maryland Health Connection and what it even is.
Yes, so my name is Kayla. I'm a navigator with Maryland Health Connection. I actually work for the Prince George's County entity of Maryland Health Connection. We're called Prince George's County Health Connect. So as a navigator, we are the people that you would come to if you have any questions about Maryland Health Connection or the plans that we offer. We're basically the people to help you navigate the system and navigate the application. And best of all, our services are free, so that's always good.
Yes, that is always good. We love the word free 99. Now, it's all about getting protected from the unexpected. And after, coming out of this pandemic, we all know how things can go when you're not planning for the unexpected. Now, with actually enrolling for health insurance under Maryland Health Connection, what do I need to know? How do I enroll?
Right. So Maryland Health Connection is Maryland's health insurance marketplace. So each state has their own, and Maryland Health Connection is the one for Maryland. So for Maryland Health Connection, you just have to live in Maryland to qualify. We're your one-stop shop to browse for your plans and to pick the best health insurance that's best for you. So to apply, you can either go on marylandhealthconnection.gov, you can do the application yourself, or you can come into our sites and see a navigator like me, and we're here to help you to do the application in person. And you can also call us over the phone, and we can help you over the phone as well. So you do have a couple options as far as applying.
Okay, so there's basically no excuse not to apply.
Exactly. Right.
Is
You
what
don't even
you're
have to leave
saying.
your house.
Yes, you don't even have to leave your house. Now, I know that there are several different plans available, but before we get into what Maryland Health Connection actually offers, what if I'm someone who, I'm not quite sure if I would even be eligible for any of the plans? Should I still, call you guys or come into the office? Can I go on the website and find more information?
Right. So definitely give us a call. You can kind of tell us more about yourself, how many people are in your household, what your income is, your immigration status. We'll put all of that information into the system, and we'll let you know exactly what you qualify for. So we do offer private plans with financial assistance. So basically everything is based off of your income. You may qualify for the private plan with the financial assistance, or you may qualify for Medicaid, which is the free health insurance.
Oh, okay. That's great. So there are a number of different options that you can look at. Now, what if I'm somebody who maybe already be using one of these plans, but I'm interested in possibly changing or my situation has changed. So now I want to look into other options. Can I do that at this time as well?
Yeah, so actually, right now is our open enrollment period. So, open enrollment is from November 1st to January 15th. So, if you have a private plan, this is the time to come talk to us about changing your plan or making sure that you're in the best plan for you. If you do your application anytime between November 1st and December 31st, then your plan will start at the beginning of the new year. It'll actually start January 1st, 2023. If you do your plan, your application anytime between January 1st and January 15th, your plan will start on February 1st, 2023. So now is the time to enroll. It is important to just tell you that our open enrollment period is only for our private plan. So if you're somebody who has Medicaid or are trying to apply for Medicaid, you don't have to worry about those dates. Medicaid is available year round.
Okay, so that was definitely going to be my next question.
Yes.
What if I miss the enrollment period and now I can't enroll? So thank you so
Right.
much for answering that. Now, in terms of the private plans, if I do decide to go with that option, say I miss that January 15th date, what do I do from there?
So you may not be able to qualify until next open enrollment, unfortunately, which starts November 1st of 2023. But if you have a special enrollment, so if you have something special happen in your life, such as you lose your health insurance or you get a new job or you get married, you have a baby, some kind of big circumstance in your life, you may still qualify for a special enrollment throughout the year. So it doesn't hurt to come to us and, let us know what's going on. You may still qualify.
Yes, like the moral of the story is no matter what your situation is, if you miss the deadline, if you're late, just ask questions.
Exactly. You
All
may
right.
still qualify. You never know.
Yes, I love that. I love that. Now, what is actually covered under these plans? Because I will be the first to tell you there's been plenty of times where I've gone into the doctor or you've gone into the ER and you're like, okay, I need this done, that done, or I'm getting this checked out. And then you find out something's not covered or you're paying way
Right.
more than you expected.
Exactly. So each plan, you do have to pay a certain amount for each thing. So each plan does cover like important things such as doctor's visits, prescriptions, mental health services, pregnancy, childbirth, and much more. So yeah, when you do the application, you just basically have to look through it to see what you can qualify for and what they cover. So yeah.
Okay. All right. So reading is fundamental.
Exactly.
You do have Kayla and the other navigators along with the Maryland Health Connection to kind of guide you through it and answer any questions that you might have. So it's not as intimidating because I know
Right.
I still call my mom like,
Yeah.
Mom, so what am I supposed to put down here?
Exactly. And it is important to let everybody know that like preventive services are always free with these plans. So if you just need your annual checkup or you need like vaccines or something like that, the preventive care is free. So another free thing, right?
Yes, absolutely. And this is another follow-up question for you in terms of, what's covered under preventative care. Does that include dental and vision, or is it more so just primary healthcare services?
It is just the primary healthcare services, but some of the plans do cover vision, and then we do have one plan that covers dental. So when you are looking for your plan, it's important that you just read or come to us, and we can let you know.
Yes, always come to them and ask the questions. That is the most important thing. Absolutely. Now, Kayla, let's get to the real tea.
Yes,
Now,
yes.
are these plans affordable?
Yes. So, like I said, it does go off of your income. But fun fact, last year, well, 2022, when people did their applications, the average Maryland Health Connection customer did save an average of $300 a month. So that is a great saving. It's always better to come to us to get any kind of savings that you can get than to go somewhere else and get no savings at all. So they are affordable. It goes off of your income.
Okay. Well, that's great to know. So it's like doesn't matter what I make, I may be able to get covered either way.
Exactly. You might still be able to get a tax credit. So definitely try and apply.
Okay. And we love tax credits now.
Right.
All right. Now, a little birdie told me that if you're between the ages of 18 and 34, for those of us under the age of 35,
Right.
then we may be eligible for some special discounts. Can you tell me a little bit more about that?
Right. So for the young people, they just decided to give us a little, extra money. So when you actually apply for the health insurance, they'll give you an extra little tax credit to go with it so that your plan will be lower. So you young people out there, definitely apply. It may be cheaper for you.
Listen, let me tell you something else, young people. Like, it's so many of us not going to the doctor, not
Exactly.
getting checked out, getting our annual physicals, checking for different cancers or even checking for different allergies. It's just so many different things. And it's really
Right.
important for us to take care of ourselves, especially in this day and time of such
Yes.
high stress, because
Right.
that really does impact our body. So whether you're in school or you're working full time or part time, take advantage of this. And we love a discount. I love
Okay.
free. And the second thing we love is a discount.
Yes. Yes.
Absolutely. Now, say I've been talking to you as a navigator, you've told me about the plans that are available. You've told me about, what I need to do to actually enroll. What do I need to make that happen? Like, what documents do I need? Do I need an ID? Do I need a current driver's license?
Right. So when you come, you want to make sure that you bring a photo ID. You want to make sure that you have your social security number as well as the social security numbers of whoever else in your household that you're applying for. You want to make sure that you bring like immigration or your citizenship information. So if you have like a green card, a work permit, or whatever documents you have, you want to make sure to bring those when you come. Whatever income you have, you want to make sure to bring that information as well. So if you're somebody who's working, you want to make sure that you bring a month's worth of pay stubs or W-2s or whatever tax documents you have so that we can see how much income you have. If you have like Social Security benefits or unemployment or whatever income is coming in, you just want to make sure that you bring that information. If you have health insurance already, you do want to make sure that you bring like that information too. We'll need the policy numbers from whatever health insurance that you have.
Okay, sounds good. That sounds easy enough. So just make sure you have all of your, documents and information with you at times of application. What if I like don't have one of those things or two of those things? Can I start the application and then come back and finish?
Definitely. So if you know the information, we can go ahead and enter it into the system. And if you don't have the actual paper documents, you always could bring those back later if we ask for them.
Okay, that's
Yeah.
really good to know. Now jumping back to, making sure we let you all know about our particular immigration status.
Mhm.
Say, I'm technically considered an illegal immigrant in this country. Am I still eligible to apply for this?
So you may still be eligible. It's always good to just come to us and ask us because it is a case by case basis. So
Okay.
definitely give us a call and we can let you know if you're still eligible or not.
All right. It's all about asking questions, asking questions,
Exactly.
asking questions. Now, say somebody is not completely sold yet. They're like, I don't need to go to the doctor. Sometimes we can be a little bit old school. We're just scared, right? Like we're scared to go
Right.
to the doctor and find out if, something is wrong with us or if we need to be paying attention to something. What would you tell those people out there who are on the fence about giving you all a call or, maybe they're procrastinating on it?
Yeah, I would just say you never know what's going to happen. Like accidents happen every day. You never know if you're going to get sick, if you'll need emergency services. So they say that like the health or the medical bills is like the leading cause of what bankruptcy. So you want to make sure that you have health insurance. It is very important. And then, it never hurts to just talk to us and see what you qualify for because you never know. You may qualify for a very cheap plan or you may even qualify for a free plan. It really doesn't hurt to ask. So come to
Yeah.
us, call us. Yeah.
All right. So even if I have kids, like I can apply and I can put on my kids. Would that go under my plan? Or would they actually have their own separate plans?
So it does depend on case by case basis, and it does depend on your income. So we do offer the Children's Health Insurance Program under Maryland Health Connection. So the children may be free even if you have to pay. So it really just depends on case by case basis.
Absolutely. All right. So, no matter what it is, no matter what your situation is, they can help you customize the guidance and the counsel that they'll give you for your health insurance. Now, I know I've had a ton of questions. I'm just asking questions, but if you are watching right now and you have a particular question about Maryland Health Connection or what plans may be available to you that are offered, feel free to type those questions out and we will try to answer them here as we go along. Now, we already talked about sort of how people can enroll and what type of help is available. Let's run it down one more time for the people. We need the website, the phone number, the address, the telegram, email for where we can send all of that.
Yes. All right. So our website is marylandhealthconnection.gov. That is the website that you can go to complete your application. And then that website can also answer a bunch of questions for you. If you're looking for the Prince George's County website, our website is pgchealthconnect.org. So you can go on that website to find all of our addresses where we are the navigators to help you. And then our phone numbers for Prince George's County are 301-927-4500, or you can give us a call at 240-719-2167. As far as coming into the offices to see us, we do have a bunch of locations around the county. We are located in the Department of Social Services buildings throughout the county. So we're located at the Hyattsville building, the Landover building, as well as the Temple Hills building. We do have a storefront location in District Heights on Silver Hill Road. But yeah, all of this information is on our website, pgchealthconnect.org. I'm not going to just give all the addresses. So you definitely can go on there to find our address or give us a call on those phone numbers and we can tell you the address.
Yes, thank you so much, Kayla. We're talking about getting protected from the unexpected. And I think we have time for a little story here from me. I guess I'll tell my age up here. I'm 31 years old and, I've been in great health like all of my life, never had any real issues at all. I recently took a birthday trip to Costa Rica. And when I got back, I was sick. I had no idea where the sickness came from, what was going on with me. But honestly, if I did not have health insurance, I would have been wrecking my brain on where I could even go to get care because I wasn't expecting that. Like I'm in total good health and this just came out of nowhere. So take it from me, from personal experience, someone who's been through it, you do not want to play around with this, especially, if you have children or if you have any family members that are dependent on you, make sure that you get covered. Even if just covered for something, that is the main goal. Kayla, am I right or am I right?
Oh yeah, you're right. Because I've seen a lot and I've heard a lot. It is so important to have.
Yes, absolutely. Now tell us a little bit more about what Maryland Health Connection is doing, what you're planning for. Are there any other events or special town halls or situations that people can attend and get more information coming up?
I'm not sure about the events, but I know we do have another Instagram Live coming up. I'm not sure who it's with, but I know it's in December. But definitely go to our website. We do have all of the information for our events on there as well.
Yes, that's so great. Perfect. And I do follow Maryland Health Connection on Instagram. So you can find them there. It's literally just at Maryland Health Connection. Of course, you can follow KYS as well at 93.9 WKYS. Now, quick question for you, Kayla, as well. What about mental health services? Like November is Mental Health Awareness Month for men. It's super important, especially after being in quarantine. Like mental health is more so at the forefront now. Is this something I were to get a plan under Maryland Health Connection? Is this something that I can take advantage of?
Definitely. So the plans under Maryland Health Connection do cover mental health services. So that's always a good thing. Whenever you get your plan, just make sure that you speak with your doctor so that you can get a mental health professional to help you.
So it sounds to me like there are no cons to this thing.
Right.
You just really got to apply and see what's available to you.
Yes.
Absolutely. Thank you so much, Kayla. Now, do we have any questions? Shout out to Brian, who's holding us down in the control room. All right, Kayla, that seems to me like we did a really good job. We don't have any
Okay.
questions here. That's great. Again, you can check everything out on Maryland Health Connections website. We just want to thank you for joining us. Make sure you get protected from the unexpected. I love that play on words so very much. Now, one more time, Kayla, just in case somebody just
Yes.
joined,
Yes.
didn't get all the tea. Can you give us the spark notes of what we talked about today, what's covered, what's available, and how I can get it?
Yes. So Maryland Health Connection, this is our open enrollment period. Open enrollment is from November 1st to January 15th. So this is the time to get enrolled. We offer financial assistance for your plans. We also offer Medicaid if you qualify for it. So give us a call to see if you qualify for the private plan or the Medicaid, or if you just have questions about Maryland Health Connection or just health insurance in general. So our phone number for the Prince George's County Health Connect is 301-927-4500, or you can give us a call at 240-719-2167. So give us a call. We're waiting to answer.
Yes, thank you so much, Kayla. And I definitely just want to reemphasize, listen, I'm so passionate about this because I feel like I've had so many different family members and friends who have, had very serious health conditions that didn't have to get to the point that it got to, all for the simple fact that they weren't covered and they couldn't receive the care that they needed. So please get out there, ask questions, apply, get the help and the resources that are available to you just as a resident of Maryland. Even if your immigration status is not citizen, you may still be eligible for a plan. Do not be ashamed, don't be embarrassed, like get yourself covered and take care of your health. Thank you so much, Kayla. And of course, thank you to the Maryland Health Connection, Maryland Health Benefit Exchange. Of course, I'm Shay Parker. You can hear me every day, Monday through Friday, from 10 a.m. to 3 p.m. on 93.9 WKYS. And if you have any questions about health insurance, how you can get covered, just bombard Kayla. It's like, I'm just
That's right. Thank you for having me.
Yes, absolutely. Thanks so much again.